So this is how hard it is to get a CAT scan of the abdomen and pelvis done. I've already been home for about 2.5 hours, and now I'm going to be starting this 5 pages of questions that they want me to answer to get this patient's CT approved. She's like in her 60s, and she has abdominal pain around her belly button, and it goes down to her pelvis and then goes around to her back on both sides. She's vomiting because of this, and she's in pain. So I'm trying to get this approved, and of course first it's denied. So here's 5 pages of questions I need to answer. Did the patient have prior imaging that supports the findings of a mass or tumor? Does the patient have confirmed cancer diagnosis? Does the patient have abdominal tenderness with palpation? Does the patient have any contraindications for CT angiography or MR angiography? Does the patient have new or progressing symptoms? Does the patient have new or worsening signs or symptoms? Does the patient have persisting symptoms related to inflammatory bowel disease? Does the patient have suspected inflammatory bowel disease? Does the patient have symptoms of abdominal pain? Does the patient have symptoms of abdominal/pelvic pain and palpation tenderness? Does the patient have symptoms of flank pain or renal colic? Does the patient have symptoms of pain, nausea, vomiting, or distension? Does the patient have symptoms of severe abdominal pain or tenderness? Has it been at least 4 weeks since the diagnosis of pancreatitis? Has the diverticulitis been unresponsive to antibiotic therapy? There's no diverticulitis. Has the patient had prior abdominal ultrasound performed? Has the patient had a prior CAT scan performed within the last month? Has the patient had a prior endoscopy performed? Has the patient had prior venous ultrasound performed? Has the patient had an abnormal ultrasound? Has the patient had prior testing or imaging performed that was non-diagnostic? Is this CT scan request ordered for treatment reevaluation or monitoring? Is this procedure being ordered by a urologist? Is this request for a general post-operative follow-up? Is this request for further evaluation of post-operative hydronephrosis findings found on ultrasound? Is this request for further treatment planning or pre-operative treatment planning following stone movement or passage? Was the endoscopy non-diagnostic, inconclusive, or negative? Was the ultrasound non-diagnostic or inconclusive? What is a patient's risk category for prostate cancer? Which of the following best describes the reasoning for the CAT scan abdomen and pelvis request? Select one. And then there's a selection of 11 that I need to go through. And then which of the following is documented in the patient's medical record to support the reasoning for this request? And there's 43 different selections that I need to go through. They already have the medical record: vomiting, pain, tenderness, to palpation. Pain is not getting better after 2 weeks. This is what you will do as a family practice doctor to get people's diagnostic tests approved. It's absolutely mind-boggling. I've already been home for 2.5 to 3 hours now working on test results, patient messages, emails, refills, and then prior authorizations to get people's tests or medications approved. This is one of the more painful ones. And welcome to family medicine. Just absolutely brutal doing this after work.